Hi everybody, welcome to AV's Maxillofacial and Dental Talk and what's next after VDS. And today it's going to be a very special episode because I have with us my student and who also was with me in my clinic for some time and currently is in the UK, Dr. Harsha Vardhan. Dr. Harsha Vardhan, welcome to AV's Maxillofacial and Dental Talk. Can you please just
Thank
give
you.
a
Thank you
short,
so much for
yeah,
inviting me
yeah, and can you
for your
please give
session.
a short intro about yourself, what you're currently doing?
So myself, like I'm currently working as a program lead and senior lecturer in health and social care in UK.
Okay,
So I work specifically with a college known as Cheshire College South and West. And
okay.
also I'm the moderator for Pearson, which is the UK's largest awarding body, who provides specific work-based learning qualifications. So this is the current role which I'm doing. So when I came here to UK, I finished my master's in public health management and leadership, and I was working in NHS. Due to all these visa restrictions and lots of immigration problems which each and every student faces, so I completely shifted my job roles into education sector and to further education sector. Yeah.
Okay, okay. So, anybody, it's a known fact that if you're a foreigner and you want to settle down in the UK, you have to clear your ORE examination, right? So, we have a couple of episodes where we have discussed in depth about ORE. So, can you just give a short description about the ORE exam? Let's not dwell too much into it. I just wanted to know, like, what is the application process? How many parts are there? And what is the exam format or something like that? Briefly about ORE.
So when you talk about
Then
ORE,
we'll get
so
into
if you want,
what you're currently doing.
yeah, so when you talk about ORE, there are two different sectors. Like if you want to work something to do something in a dental sector, so one is the dental healthcare professionals. The other one is the dentist, the ultimate aim, which we all are here to get the registration number. So when you talk about the dental healthcare professionals, which comes under like dental hygienists, dental therapists, and all these kind of things. So what happened is when I came here, so I started my master's on 2022 September. So there's something, a society known as British Dental Society. So what they don't like people like immigrants from all other places to get directly registered as a dental hygienist or therapist. So there have been a court case which is going on for a very long time, and they have came to a decision that on March 2023 they are going to end the registration route for like to getting registered directly as a dental hygienist or therapist. So that route has come to an end on March 2023. So
Okay.
what all over globally, what happened is like all the agencies or all the companies which works to this registration, like not only India, I'm talking about all other countries globally. So they all pulled in the application between the month of Jan 2023 to March 2023. Because the route is going to end, they still have the window period of Jan until March. So there has been a huge backlog of application in the General Dental Council here in UK. So they are processing but they'll process at a rate of 20 to 30 applications per month. You can't track your application. So it's like all you can do is like check your mail every day, whether to get an update from General Dental Council or not. And still they are in talks to tell the new registration process for getting registered as a dental hygienist and therapist.
Okay.
So what the process looks like is like if I want to practice in a dental sector, the practice what we do back in our place in India is completely different from what they do here. So you have to get the experience of what should be done here, like how the practice looks like here. So the only way to get into a dental clinic is via this registration or the dental nurse. But the thing is, we don't want to downgrade ourselves to dental nurse. That's a mental thing because we have studied a lot, we have gone through a lot, but we don't want to downgrade ourselves. So this is the current status. I have filed in my application on February 2023. It's been almost 1.5 years. Still, I didn't get a reply from the council. So I've been waiting for my reply. This is for the dental hygienist thing.
Okay.
So when you talk about ORE, so the ORE application process is completely a different process where you have to file in your application and they'll approve your application and then only you can sit for your exams. So my application was filed in 7-8 months back. So the council told me to do a few corrections. For example, there are specific things like if you're working in a clinic and if the clinic doesn't has a domain mail ID or something that they'll reject your application, they need a specific letter to state that. Like, for example, I was working in your clinic And
So
I
you're
know a
talking
clinic
about
as
the
a
clinic where you worked in your native country, or the clinic where you are
no, the
working for
native country.
the native
So there
country?
are a lot of for the application process, you have like a lot of procedure like character reference, working as reference sheet, and
Okay.
all this thing for that. So for example, if I'm giving you as a reference, you should be having a proper domain mail address.
Okay.
So if I mention like Vinay@gmail.com, they'll not accept that. You can fake it, right? So they don't believe all this at gmail.com. So what
That-
mistake I did is what my character reference did not have a domain mail ID.
Okay.
So they told me to add a separate letter with affidavit telling that they don't have a domain mail ID, hence they're using the Gmail account.
Okay. So you have to be very authentic about the details you are
Yes,
giving them,
yes.
and you can't just fake it. And okay. Now, one other thing is, you told me like you wouldn't like to downgrade like for the dental hygienists or therapists and all. But I have heard of few stories where people temporarily register themselves as hygienists or therapists, work there until they become actual dentists there. Now that route is it completely closed, or there are because
It is completely closed. So now they are in the state of doing a different registration process, but yet we didn't get a reply from the council.
but what if someone genuinely wants to become only a hygienist or a therapist?
They have to wait for the update from council. So until March 2023, there was a route where education system like a BDS, what we did in India, we can directly get registered without any exam. It's all about the documentation work which we have to do. But
Okay, okay.
unfortunately, 2023 March, they are like that is the last day for this kind of registrations, and they are yet to decide the proper route for getting registered as a dental hygienist and therapist for
So
overseas candidates.
the legal issue is still going on there, right?
Yes, yes.
Can he and what is the existing ORE part one, part two, part three? Can you just quickly go through that part one?
No,
Is it parts or
like
three parts?
I've it's two parts. The thing is like I've saw a lot of video, but the main thing which I wanted to focus is lots of video on AV's answer which will talk. So the main thing which I want to focus is about everybody knows what to do, what to study, and how the examination process happens, but they all fail in the first step is known as the ORE, where your application should get accepted. So there's a certain way to do the application. So it must be like very proper way, your application. So what I suggest is to concentrate on your application first, let your application get approved, and then you can focus. So you will have 2 years time to sit for the exams. And now they have increased the slots for ORE part 1 and 2 as well. So getting the application approved is the biggest challenge I faced.
So good luck with that. I really hope
Thank
you
you. Thank
do
you
it
so much, sir.
quickly. And coming to the main subject, so what is Harsha currently doing in the UK? I remember before the beginning of the video, I'm trying to recall what you said, but I'm sorry, I'm not able to get it. So it's better you yourself explain as to what you're doing it, why you're doing it, and how is it going to help you in future or your ORE registration.
So I came with a dream of getting registered as a dentist in UK, but unfortunately there are a lot of struggles with international students face here. It's because it's not that UK doesn't has job opportunity, it has, but the way we are trained are completely different from way what they expect. So the thing is like they focus mainly on skill-based application and value-based application. Doesn't matter whether we have a degree, doesn't matter whether we have experience. If you have the proper skill and if you have the proper value, like if you can replicate the value, for example, I was working in NHS with the medical education department. So their value is known as proud values. So starting P for patient first, respectful, you have to replicate the value of the trust. So ultimately, you should be a good person to get into that job, like good person who replicates the value, who respects their value. So
But how do you
this
test
is
that
the thing.
skill or value? Like, what is the way
Their
of
whole interview process is they don't ask much about your experience. They don't ask much about what you do, like what your background is. They test your skill and values based in the whole interview process is designed like that. So I came here for my master's on 2023 September, and then I joined NHS. I was the only candidate selected from the School of Health, Dentistry, and Medicine from like I did my master's in University of Sheffield to get directly associated with the operations director of Sheffield Teaching Hospital Trust. So where I had the opportunity to travel with the whole hospital operations for 1 year with the director himself. So then I was offered a job in NHS as a patient service coordinator. And also I was volunteering with the medical education department to train. So for example, we have lab exam as in medicine. So when a newly trained doctors join NHS, they must be trained. So here, how it works is like each place has different trusts. For example, if you talk London, they have a different trust which is working. So under each trust, there'll be different hospitals. So for example, if I'm joining as a newly doctor in NHS, am I audible, sir?
Yeah, there is just a small interruption. Now it's okay. Yeah.
So if I joined they should be aware of what are the rules and procedures or what the specific trust values are. So I was facilitating the newly joined doctors in NHS, but unfortunately, in my trust where I was working, I was not sponsored with my visa. So even though I had a 2 years postgraduate visa, I wanted a skilled worker visa, which counts to your ILR. If you want to settle in UK, it really counts. Your postgraduate duration of 2 years after your master's doesn't count to your ILR. So what I told is like, after applying a lot of jobs, as you know, like it has been a huge struggle. So I started focusing on the education sector, and I practiced skills which is required to enter into the education sector. So after that, I was appointed as a senior lecturer in health and social care, where I trained students. Like there are two things in UK. One is the higher education, other one is the further education. So higher education is the one which we study, and further education is the one people here, for example, if they are completing school, they'll directly join the further education college and they'll be trained to increase the employment.
Are you there?
If you take S6, there is a majority of international students join high. Yeah. Can you able to hear me?
Yeah. I can. Yeah.
So higher education and further education. So higher education mainly focuses on international students, whereas further education focuses on the current learners who are in UK.
Say local students of UK, right? Probably.
Local students of UK, yeah. So what they do is they don't want a degree. They don't want to do more. All they learn is the skill for employability. They get directly employed. They'll start earning at the age of 16 or 17. And then they slowly progress. So this is how, so I used to train them. And then within a span of 3 months, I got promoted as a program lead, where I had the opportunity to lead a course known as T-level health. So, and this is my journey.
That's nice. So you have currently done your master's in health and social care, and you're training the upcoming students, right? If I'm not wrong.
Yes, I've done my master's in public health management and leadership.
Public health management and leadership. I'll catch that. And
yeah,
and one
and now I'm can't hear you.
One other thing which you said was,
I'm teaching learners who are there in health and social care.
Health and social care. Okay, fantastic. So okay.
So for get into teaching sector, to get into teaching sector, so you need a specific license or qualification to teach someone, like no matter wherever you work. So for that, you need to have a master's in education or postgraduate certificate in education, specifically in UK, which talks all about safeguarding and how you should teach learners. So they concentrate more on equality, diversity, and inclusion, as you'll be aware of. So the college sponsored me to do an additional part-time postgraduate course, which is on education, which I'm currently working on it.
Superb. That's wonderful, Harsha. Now, you are going to do this until your ORE application is processed, if I'm not wrong.
Yes.
And suppose, just say, do you have a career or a future if you're going to continue to do what you're going to do, what you're doing currently here? Can you like go up? You said you're a senior lecturer. So can you become a professor, or climb up the ladder further?
So to climb the ladder further, to go into universities, so you need to have a PhD qualification as well as the teaching qualification. Okay. So I'm currently working on the teaching qualification, but if in future, if I wanted to continue here, I will jump into the management sector rather than teaching sector. For example, there are different roles like assistant directors, managers in the college, in the education sector. So I'll be working towards that rather than to become a professor.
Okay. But any specific reason why you wouldn't want to? Okay, naturally, one, is it because of the tedious PhD process, or what is your specific
No, the
reason?
two things. So the two things which plays a first one is the money, the second one is the visa. So
Okay.
like so to sort out two things, you must have a proper job to be independent, to stay here and do whatever you feel like, and then you can progress slowly. So for example, like most of the international students will take a huge sort of education loan to come here and study, and they'll struggle a lot to repay the loan. So if you want to do PhD, very few. The main priority is for the local learners who they'll get funded for the PhD. So it's not like international students will not get a fully funded PhD. They will. The competition is very high. So it works like that. So I don't want to risk it. So due to personal reasons, I want my visa to get sorted, as well as I want to become financially independent. So that's the reason I have chosen the further education department. Because we have like, I don't know whether, I think I limited myself, like with my background and experience, like it's only health and education where I can get enrolled myself. I can't do an IT job. I can't go into medical coding or
Absolutely.
whatever, because I'm not trained in that. Yeah. So
Very
that is the
very
reason why I'm working here. Yeah.
makes sense also. So Harsha, were you aware of all these challenges before you jumped in or went to the UK?
Not at all. Like
Not at all.
scrolling Instagram, as you know me, like I was working in your clinic, like scrolling Instagram and all these things. It seems to be all fancy stuff, but the reality here is completely different from what we see in social media and posts. So to be specific, there are only 7% of international students from India who get their skilled worker visas. It's a very low number. So rest all don't get a skilled worker visa.
And
So
the first step would be to focus on the application process, right? Rather than focus
in specific to dentistry, the first step is to do a proper application for ORE. And then doesn't matter even if you downgrade somewhere, the pay is going to be good and everything is going to be sorted out. You can get enrolled as a dental nurse in a clinic, and then you can get a feel of the environment rather than waiting for dental hygienist or therapist registration. You can get enrolled as a dental nurse assistant or whatever, any role in a dental clinic, so that you will be aware of how the culture is and how the people are, what their expectations and what are the rules and regulations, and so on. Yeah.
And by any chance, I just wanted to know that. So once you complete your ORE, okay, registration process, you become a licensed dentist to practice there. Is there a course or is there a way to become a postgraduate, like how we have MDS here? Is there any way here? I'm aware of
there are clinic
M-Clin Dent. That is one which I'm aware of.
Yeah.
I just even had a couple of interviews on the same. But is that the postgraduate degree or is there something else?
Yes, that is a specialization degree which we compare here as MDS, like orthodontics and all this thing. But usually when you do BDS, like a lot of people stop with their Bachelor of Dental Surgery here because they earn a lot of money. They don't want to progress.
Okay.
The thing is, like, the problem with the current learners here is they don't want to work hard. They want to earn money easily. They want to settle quickly. They don't give time to prioritize like how our education system works back in India. So they don't study much. They don't want to learn. It's only us, the migrants, who wants to keep on learning, like stay on the track and get updated with the latest technologies and courses or whatever. But the local learners here, they want a comfort zone. They will not squeeze their brain to get something big.
Quite surprising when you say that. You always have different opinions about them, right? You know, they're going to be huge competitors for us and all that. So yes, so this is one way for people who are watching, like when you're going to prepare you for your registering for your ORE, you need to be focusing on your application first, and you can do what Harsha is doing. Are there any other options apart from what we just mentioned?
So if you're having a dental background and few management, like if you have the skills to manage, for example, you should have the management skills in the hospital back in our place rather than working in a clinic. If you can get more involved in administrative tasks or management, like if you're managing a whole clinic, if you have the experience of managing a whole clinic or a hospital experience, you can definitely end up getting a job in the management sector in NHS. So NHS, as you know, they are the largest employer of UK. So they have a lot of vacancies. Even though we are overqualified to get those jobs, what we lack is skill and values. So if you have proper training for the skills, and if you're able to sell your skills, you'll definitely end up getting a job in NHS. There are a lot of benefits when you work in NHS as well. So by the meantime, you'll be financially independent, you'll get your visa sorted, and then you can do whatever you want to, like what your aim is. If you came here for ORE, you can slowly do that progress. And also to add on, like I like to tell, like there's a new course which has been introduced in UCLan. The university name is UCLan, University of Lancashire. Not sure about the university, where from India you can do the application process. So it's a 3 years program. In the 3 years program, so you'll be called for an interview and you'll be having a small exam, like a very simple exam. If you get admission into that, after the 3 years of training, you'll be directly registered as a dentist. Okay. So this is the newly program which is approved by the General Dental Council.
But it's restricted only to university.
So now only one university has started that with tie-up with the councils, and there's a dental group known as My Dentist. So they are working together to figure it out. So, but the thing is, the international course fee is going to be so much high to get enrolled. So if you can spend a lot, you can definitely get enrolled in that course. So 3 years you have to, the course name is Bachelor of Dental Surgery International Route. So it's a 3 years program.
Okay. That's wonderful to hear. Now, one final question is, in fact, I have two. So the first one is, I know people from India who have gone to Malaysia. I'm just specifically mentioning the country where they join as professors or lecturers in a particular university. They are not allowed to practice in Malaysia. They cannot set up their own clinic, but however, they can be in the academic roles, like institutions or something like that. Of course, they have to go through some application process or something like that. Do people from India have similar opportunities where they can be only in the academic side, teaching, associating themselves with an institution? Can something
so when you talk about dentistry, if you want to get associated in dentistry, all they expect, the most, like 90% of the criteria is you must have a GDC registration number.
So ORE is mandatory.
Even if you want, it is mandatory. Yes. Okay. If you want to go even into an academic center, which is clinically based, for example, orthodontic or whatever, in a dental hospital or a dental college, so the ORE registration is mandatory.
Okay. And the last question is, of the many countries in the world, there's US, there is UK, there's Australia. Why UK for Harsha? Any specific reason?
Why UK? Like, I was so scared about the investment which we do in a master's, because when you go to US, like, it's, you know how the course fees are for the international student, whereas in UK it's not much. So I had a hope that even though if I don't find a job or if I don't sort out anything there, so I had a confidence that by somehow I can repay my educational debt which was taken back in India. It was not so much, as you'll be aware of. So, and it's also a 1 year master's. I don't want to waste time, being honest. Yeah.
Smart. Thank you so much, Harsha. Thank you so much for your valuable time. And is it okay if I share your email ID so that if somebody wants to reach out to you, they can reach out?
Yes, definitely.
So I'll share it as a thumbnail at the beginning of the video as well as the end of the video. Thank you so much. All the best. See you soon.
Definitely. Thank you so much, sir. Thank you so much for the opportunity. It all started from your clinic now. where you gave the freedom to work, even though there are no patients. I worked in different clinics, but there's quite a very good environment in AV's dental clinic as well, because you gave me the freedom to do whatever I want to. So
that sounds
thank you so much,
right? Just kidding. All the best, Harsha, once again.
Thank you so much, sir.
And if I'm visiting the UK, I'll definitely come and see you as a dentist there.
Sure, sir. Sure. Always welcome. Thank you.
All the best once again.